Yes.
Democracy's alive.
We are a democracy.
The show's ruined everything.
Hello, everybody. Welcome to fabulous Las Vegas, Nevada. This is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. It's Mental Health Awareness Month.
Woohoo!
Happy May, everybody. And now broadcasting from the churn, that's Dr. Jim. That's Whitney. I'm Nick. It's time for some Pod Therapy.
It's officially May, everybody.
Yay.
It's May. It's gonna be
May.
So it is Mental Health Awareness Month. And if you are listening to this airing on May 4th, I believe, right?
May the 4th
Be with you.
be with you.
May
Nick
be
took a
with all of
drink.
us.
I did. I couldn't finish that sentence.
Yeah, what a big week. It's May the 4th be with you, Cinco de Mayo. Oh, no, 5th is Revenge of the 5th.
Oh, yeah.
That's the big thing. Anyway, my point is, if you're listening to this on a Thursday, we did our Reddit AMA on Wednesday, May 3rd, and it is probably still live on that Thursday. It almost always goes for
Yes.
24 to 48 hours. So if you'd like to get down there and drop some questions in the comments, we will keep answering them pretty much until they stop coming in. And if you are new to the show, welcome. We are excited to have you. This show is a 6-year deep experiment in what it looks like to fuse comedy with real mental health from real therapists. And it's a question and answer show. So real questions get thrown at us all the time. You can submit your questions. The easiest way right now is actually through our email address, PodTherapyGuys
Why is that, Jim?
gmail.com, because our website got hacked and deleted, and our listeners are furiously working on putting up a new one. So maybe it's active by the time you hear this. PodTherapy.net is the website. Come check it out. But we'd love to have you be part of this community. You'll hear us talk a lot about our Patreon, which is a very active community in Discord. Lots of extra content goes up there every week, and you can find all of that at patreon.com/therapy. But we got some great questions to jump into today.
If we've got potentially new listeners,
Oh, yeah.
should we say who we are?
Oh, let's start with that.
Let's do that.
You do it. You start.
I'm Nick.
Hi, Nick. How are you doing today?
I'm good. So my name's Nick Tangeman. I'm the one of the hosts,
You're the
obviously,
pretty one.
for Pod. Oh, thank you.
Yeah. Well, until Whitney got
Thank
here.
you.
Yeah. You're the
No,
original.
we could have just
pretty
left it at that.
Yeah.
That's
fine.
fine. That's
It's
fine.
okay.
Just-
I don't have to be the prettiest.
one. Okay, that's true.
Stealing my thunder. Yeah. So my background is mostly in substance use, but as well as co-occurring disorders, so co-occurring mental health.
Yep. And personal training.
Thank you. I keep
You're
forgetting
welcome.
to talk
is-
about that.
You should. You should. You are certified in that as well.
So
Many
I am
aspects
a
of
certified personal trainer, certified
loss
nutrition
specialist,
coach,
yep.
weight loss
it.
specialist.
I know because I sent somebody
So-
to your website today.
Yeah. Oh, you did?
MentalFitPersonalTraining.com.
mentalfitpersonaltraining.com.
Yeah.
Check it out. I do so my program is basically therapy informed personal training.
There it is.
So basically I take what I've learned from working with folks in addictions as well as in mental health, and I apply it into personal training. So I do that in person. I also do it virtually online. So if you're interested in any kind of personal training, mentalfitpersonaltraining.com. The
Virtually-
website that hasn't been hacked.
That's right. So far, knock on wood. Way to
it
tempt
won't.
fate.
It's,
Yeah.
it's solid.
Yep. So, and remember, he does it in person or he will cyber with you. So, Whitney, introduce yourself.
Hi, I'm Whitney Lewis, and I'm a licensed clinical social worker here in Las Vegas.
Yay.
Yes. Have my own private practice right now with Nevada Mental Health Associates and other team members that work there too. And yeah.
Broad background, done it all.
Yeah.
Mental health,
worked
with
in
youth.
foster care. I still work with some teens, some adults. Wide array. There we go.
There it
of working with anxiety, depression, just life struggles.
Yeah, Las
So-
Vegas therapy, we get to see some shit.
Yeah,
we've
but there's
seen
a lot.
some shit.
There's a lot.
Yeah, I remember when Nick and I were running rehabs, and it was always like the question we'd get is like, why in God's name would you guys put rehabs in Las Vegas? Like, first off, really easy to get people to come here.
Yeah.
Yeah.
Oh, yeah.
Yeah, you got some guy in Tennessee who's like, I think I need to get clean. I'm going to Vegas.
Well, yeah. I mean, like you do an intervention, someplace out on the
Okay.
East Coast, and they're like,
Right.
I'm not going. It's in Las Vegas. All right.
I guess I'll check it out.
All right.
Maybe the sobriety thing will
Fine.
Who knows?
Yeah.
Yeah, you never know what you're going to roll at the craps table. So, yeah, Vegas, a weird place to do mental health, but I think it gives us tons of experiences to see really unique populations. And, I think you have to, like, the old joke is, like, the best shark bite clinic in the world is in South Africa where the great whites live, right? Or, like, the best snake bite clinic's going to be
That's
wherever
how
the black
I think
mamba
about
is.
rehab. I'm like,
Yes.
Vegas? What
Yeah,
the
best
fuck?
rehabs have to be
Yeah.
in Vegas, right?
Yeah.
Because you better be damn good at this if you're
Yeah.
going to make it work. So, mental health in Nevada and in Vegas is a strange thing. I'm Jim. I am a licensed
Shark bite clinic expert.
Shark bite clinic expert. So that's why
Jim
I do what I
knows
do.
his shark bite clinics.
Let me tell you something about snakes.
And Spirit Airlines connoisseur.
Yep.
I'm just here to talk about snakes.
Shark bites and
I know
Spirit
a thing or
Airlines.
two. It's
Related?
aviation.
I don't know.
Damn near. All right, my background: mental health, clinical professional counselor, and also an addictions counselor here in Nevada. And just broad background as well. And we started the show because we thought, man, it'd be great if mental health could be talked about in a useful way, but still infuse comedy and make it casual, make it fun, and create a community around that. And so 6 years running, we've been doing it. People writing questions. We have a great community of listeners that support the show, and welcome to it. And we hope that this is something that you'll find fresh and innovative and unlike anything you've found anywhere else in your podcasting journey. So welcome, Redditors, and glad to have you with us.
And we've got Jacob. Jacob, what's the population that you specialize in?
There's that.
I hit record.
Yeah.
you
Jacob
go.
does a little bit of that. Jacob does a little bit
Jacob's
of everything.
our producer and comedy sidekick.
An honorary life coach.
Yeah.
Honorary.
Sorry,
Sorry.
certified.
Shh, why
I
don't you
have
say
business cards.
He does have and a jingle.
And a jingle.
Yeah, a whole light effect and pyrotechnic show. So
There's a whole thing.
more things than we have, but and that's
I
the
don't know if
team.
Whitney's seen my business cards.
No, I
has
haven't.
Whitney
Let
never
me
seen
see.
those? Read that out loud.
Okay. Audio guy, life coaching, listening for a living, not just to you.
Just not to you.
Just not to you.
Just not to you. Yeah, there we go.
Yep.
It's fine.
that's the
That's
motto.
very quotable.
And
It's fine.
no phone number on there.
No.
Yeah, he'll call
Don't
you.
contact him if
Don't
you need
contact.
It's
anything.
on the back.
It's on the back.
Ah, there it is. Phone.
If you need me, I'll
call
find
you.
you.
Yeah.
No refunds. Results may vary.
Right. You can keep that. You can keep that.
Oh,
Yeah,
I'll
give that
hand
to
it
a
out.
friend.
I'll
Yeah.
hand it out. you
Write it
know?
on a bathroom stall wherever
Absolutely.
people find that they need that help. So, all right, we've got some great questions today. Some deep ones here. First one: postpartum depression. Hello. Please keep me anonymous. No problem, Roger. I love the pod. Been listening since your first ice cream social appearance. I have a question about
was a mistake.
postpartum depression.
First-
Not on your part.
first
On
mistake.
our
No,
part.
that's
for
on
having
you.
them
Yeah,
on.
we show up. Yeah, you invite us. We're coming.
Yeah.
A friend
No, I
of
meant not on the writer's part. The
No,
writer
the
didn't mess
Writer,
up.
good question so far.
I messed up.
Yeah. Jacob regrets ever allowing us on his bigger podcast, which has given us any platform at all. A friend of mine was recently diagnosed with postpartum depression. They had signs of it after their first child, but it got a lot worse after their second. I'm wondering what to expect, especially since they refused to see a psychologist or take the medication that was prescribed. They've recently done something that may blow up their relationship with their spouse. So I'm wondering what kind of cognitive distortions are common with this diagnosis. Sorry for being cryptic about myself. It's very hard to write about this at the moment. Thanks for all you do, Anonymous. Also, the writer's real name is not Roger. That was my attempt at a quick anonymous joke. Thanks for playing along at home.
I'll laugh at it later.
Thanks, bud.
I'm just putting that one in my pocket.
Yeah. Note to self.
Yes.
It's a good time to remind everyone, if you want to be anonymous, if you want to write it anonymously, perfectly fine. You don't even have to take out a different email, although you're certainly welcome to do that. If you just ask to be anonymous, we will keep you anonymous.
Yep.
Yes.
Nobody will know.
Yep.
So
Honestly, we won't even pay attention to your real name.
Yeah, honestly, we forgot who it was.
Yeah. That's just sincerely what we'll do. We will forget it.
Don't worry.
I've already forgotten the question.
I think it was on postpartum depression.
So wondering what kind of cognitive distortions are common. Are there cognitive distortions common with postpartum depression?
Probably should talk about what those are.
Okay, well, cognitive distortions. So we talk a lot on this show. We've talked a lot about cognitive behavioral therapy, but essentially a cognitive distortion is a way in which the brain can kind of change or distort information to coexist or fit with an existing belief system.
Yes.
Okay. So our belief system, we all kind of view the world through a filter, and that filter is created through past experiences. So because of my past experiences, I see the world through this filter. I interpret that as being reality. The problem is that all of the information, if this is reality, all of the information has to fit. So when I get conflicting information that doesn't fit, I'm left with a choice. I either change my view of reality or I distort the information to make it fit with what I already believe. So that's just kind of an example of a cognitive distortion.
Which leads to bad things. A cognitive distortion is kind of like a mental mirage. It's a false perspective. You're not hallucinating a pink elephant when there isn't one. You're just misunderstanding something. So if Whitney had the cognitive distortion of catastrophizing, imagining the worst thing could go wrong, and I say, oh, Whitney, did you cook dinner before you came here? And she says, oh, yeah, I made some soup on the stove. And I say, great, did you turn off the stove? Now, Whitney's immediately going to think what?
Oh, no. Did I turn off the stove? I don't think I turned off the stove.
And now my house is burning down and everything is
And now
gone.
Jim's gaslighting.
Yes. Oh, that's right. Sorry,
Like,
that's a different
did I?
That's literal gaslighting. Though. I would never metaphorically gaslight Whitney. Only literally. So yeah, those are cognitive distortions. So postpartum depression, this happens a lot. And I think
Yeah.
it's something that a lot of women don't get enough attention on because I think women generally, whenever they present with mental health symptoms, a lot of times they just kind of get like, oh, poo-pooed, or like, oh, this will pass, no big deal.
Yeah, on top of the fact that you've just given birth and are dealing with things like lack of sleep
Oh,
that
yeah.
can also cause
Sleep
you to feel
deprivation
crazy.
is a form of torture, man.
Yes, it is. Oh my gosh.
Somebody screaming in your ear to wake up so they can suck on
Every
your chest.
3 to 5 hours.
Yeah,
Oh
that's a
my
thing.
gosh. Yeah. So I think whenever women are in this phase of life, it can be confusing to know what is normal and what is beyond normal. And they're not really talking about it usually with others. They may think no one will understand. They may think no one else has dealt with it because they didn't talk to them when they were pregnant or going
Right.
through things. So
And there's a lot of shame.
yeah.
A lot of shame and isolation.
Like, am I a bad mom then?
Yes. A
Mhm.
lot of moms are afraid to tell anybody because you're supposed to be so joyful. People
Yes.
call you and they're like, oh my God, congratulations. Oh, there's all these
Yes.
beautiful pictures. You must be so happy.
Yes.
And you're like, yay, I'm
Yeah.
great.
It's very taboo to just say, man, I'm a little bit miserable and tired right now. Even though I love this baby, I would die for this baby. I would not trade this baby for the world.
Right.
I'm also miserable.
Right.
And so for now,
So, like, sudden onset depression is
Mm-hmm.
basically what postpartum depression is. And it can have a lot of those classic symptoms, sadness, tearfulness, feelings of hopelessness. It can also have huge mood swings, irritability, anger. There's one particular symptom that sometimes happens with PPD that we do want to take pretty seriously and normalize it in this question. Some moms even think, I want to hurt the baby.
yes. Yeah.
And that is terrifying for them.
Yeah.
And they feel like, I can't tell anybody, like not my
Yeah.
spouse, not my doctor,
Yeah.
because they're terrified, like in 5 seconds, CPS is going to take that kid away.
Is that just what's the thought? The invasive thought?
It's an intrusive thought.
Intrusive thought. That's it.
Yeah. And it also has to do with those hormonal imbalances, estrogen, progesterone, just off the charts trying to adjust.
Mm-hmm.
Again, sleep deprivation, those cognitive distortions.
Mm-hmm.
And they can just get so overwhelmed with despair, hopelessness, and then being so confused about why they're not just naturally bonding to the baby.
Yeah.
And sometimes they do have an intrusive thought of like, what if I hurt the baby?
Yeah.
Or maybe I don't want the baby. And they think, oh my God, I'm a monster. What
Yeah.
am I doing? I'm not fit to be a mother. I can't tell anybody about this. And the truth is you should talk about
Yeah.
it. Because, especially as therapists, we've heard this. We do expect this. In fact, if we ask, but a lot of new moms are scared to even come talk to a therapist because they feel like that's defeat.
Which seems like that might be what this person's friend is going through if they don't want to even go. I don't know. It says they have a prescription, so it sounds like they've been somewhere that they
Yeah,
have a prescription.
But maybe they refuse to take the medication that was prescribed.
So I have a friend of mine who has 2 children, but there's a large age gap there. So their second child was much later in life. So I'm not sure if they went through this with their first child, but with the second child, after she was doing better on the other side of it, she did confide in me that for some time she was having postpartum depression, but where it really affected her life was with her spouse. And it was even, 2 years after the baby was born.
Wow.
It's ongoing,
it can last.
So it was like building. And she said that once she did decide to take medication for it, it was like a light switch flipped, and she realized, like, she almost left her husband, even though he's a really great guy, but in her mind he was horrible. And she was basically like sabotaging unknowingly, but sabotaging her relationship because of the thoughts going through her mind about their relationship. And she's like, I felt like she used the terms, like, I felt like I was going crazy.
Right.
And once she got her levels, managed through medication,
it really brings you back to earth.
It did.
And we see that a lot
so
even during
now,
pregnancy. I mean, like postpartum for sure, but a lot of times first trimester, like that's whenever a lot of levels start to adjust.
Yeah.
And there can be a lot of conflict in the relationship, a lot of anxiety, a lot of jealousy, a lot of irritation. And whenever you have that new baby, especially if it's your first one, you're learning how to be parents. So you're already kind of fumbling through this process. And then it's like, why don't you ever help? And it's like, and I remember as a dad being like, the baby doesn't like me.
Oh,
like,
yeah.
I'm the least popular person in this family.
He never wants me.
My polling is terrible. Like, this kid has
I've asked you
That
not
feels
to
great.
refer to me as the baby.
Yeah, sorry.
I bet that feels great as a new parent too. You're like, wow, I'm like struggling here, and you get zero.
And it's tough because as a dad, you're like, I want to help so bad. So in this writer's question, a lot of things are already happening here that I think all of our alarm bells are going off. 1, we're not seeing the psychologist that we know we already have one for. 2, we're not seeing the writer's friend take the medicine. That's not great. 3, writer says, hey, my friend is blowing up their relationship right now. And is being cryptic, but is saying like, dude, they're kind of doing something right now that might be about to knock the wheels off of this. So this is a tricky one because obviously to the writer, there's not much you can do as a friend except to, I think counsel your friend who just had this baby and try to tell them, look, this is a real thing. Don't trust your feelings right now. Please don't make permanent choices. Like, give this time, talk to the therapist.
Or try it.
Try it, get the medicine, try anything. But if you're the friend watching this happen, I think you're pretty powerless in this scenario.
Yeah.
Yeah. I mean, I think there's different ways that you can intervene here. Obviously, if it's there. So my original thought is thinking like, if I have to try to talk somebody into something, if I really want to kind of direct them a certain way, what I always do first is I find a point of agreement.
Yeah.
Okay. So, I'm over here, they're over here. I want them to move this direction. I can't do that when we're in 2 different spots.
Right.
So I kind of go down to the very, very basic levels. I find one thing that we can agree upon and then slowly try to pull them one direction or the other.
Right.
So if your friend is not willing to see a psychologist, not willing to take the medication, and is doing whatever this behavior is that's harmful, is there some level that they will agree with you on?
Right.
Hey, life isn't the way I want it to be right now.
We can agree to that.
Perfect.
Yeah.
Okay, so that's our starting point.
Are you happy? No, I'm not happy.
Excellent.
All right, let's start there.
But yeah,
great. You know what? It gets even worse.
Yeah.
They canceled The Office. Shit. It's not on Netflix anymore.
Good current reference, Jim.
Sorry. It's 2023 when we're recording this. My bad.
But you find
I kind of just discovered The Office, guys, so it's
Oh
kind of
my
a big deal for me
gosh.
that it's been canceled.
Maud is off the air.
Golden Girl.
B.
Killed Dallas.
B. Arthur is dead. Gracious.
find that common ground and then slowly work to kind of urge them step by step closer towards getting help.
Right.
So it's like, okay, I don't want to get help for depression. I don't feel like I have that. I don't want to take these medications. I am very unhappy.
Yep.
All right. Well, are you willing to talk to somebody about just being unhappy?
We should go talk to somebody
Right.
about your relationship.
Right. Whatever that
And
may be.
that's a great hook.
Right.
I mean, how many times, Whitney, have people come into our offices like, I'm here to bitch about my spouse. And we're like, get it out, baby.
Yeah.
And they're like, I'm not the problem. That asshole
Yeah.
is. And we're like, you bet.
Yep.
I'm cool with
Absolutely.
it.
F them.
Yeah, fuck that guy. Like,
Yeah.
tell me all about him. Tell me what a bad dad he is and a bad, he doesn't appreciate me. And this other guy I'm talking to kind of does. Great. This is the right place. This is the complaints department. Bring it in here.
And exactly. So what you're doing as a therapist is exactly what the friend would do.
Yes.
You don't start off with confrontation
No.
about like, no,
Don't do
you're
this.
wrong. This is
Yeah.
what you need to do
Right.
because they've already tuned you out. Now, having said that, I'm going to walk that all back
Oh, right.
because
Rewind.
That is very therapizing of you.
It's deep.
there may be incidents in which you're not going to pussyfoot around like that.
Right.
If there's any kind of suicidal ideation,
Yeah.
then we're not going to mess with trying to find common ground.
Right.
You need to intervene. You
Yes.
need to say, no, okay, we need to get you help. We need
Or
to call somebody.
homicidal idea.
Yeah,
Right.
homicidal
Yeah.
ideation,
Right.
thoughts of harming somebody,
Or the
harming the
baby.
baby, something
Yes.
like that. Then we need to deal with that. But again, in this example that you brought up, we don't want to necessarily, like, if they're saying like, oh, I'm very stressed with this baby and I just have these thoughts that I'm not going to hurt the baby, but I just have these, like, okay, we need to take that seriously.
Right.
We also need to somewhat kind of like, I don't want to say normalize, but kind of like, okay, hey, this happens.
Right.
You
We
know,
don't want
this
to
isn't-
villainize
You're
you.
you're
Right.
not a criminal.
Right.
You're not, there's nothing wrong with you per se. This happens, right?
Yes.
So there's kind of that ground in there that we need
Yeah,
to
but
navigate.
I want to echo what you just said about if your friend has said anything about self-harm or harming the baby, it is okay to do an anonymous tip to child services. You are not the first human in history to call, and they know what to do because if they have the name of the mom, they can even call the hospital and say, hey, hospital that released this mom X number of days ago, can you guys do a wellness check? And that's not uncommon for like the nurse department to call and go, hey, this is like a new mommy check-in. We just like to, do you have any questions? And sometimes new moms will feel more comfortable talking to the nurses and be like, yeah, actually, I've been really crying a lot. And like, is that normal? And be like, great, hon, let's talk about that. And they can point you toward resources.
On top of that, I think there's a huge fear with calling CPS for
Right.
Normal humans
Right,
out there
the
who aren't in
civvies
the
out there,
yes.
yeah.
That, oh my gosh, if I call, they'll just take the baby away or something. And
No.
it's like, that's not the
No.
first
The
thing
system
that
is not
happens.
about seizing children
Yeah.
and storing them in some cabinet.
Yeah.
Like, the wellness checks are okay.
We don't even have that cabinet anymore.
No, yeah.
No, it's
in
full.
this
The budget-
economy,
the budget for the cabinet has
woodworking?
been cut.
No,
Yeah.
we got rid of those cabinets a long time ago. It's dirt floors.
Yeah.
We're down to
Right.
nothing. Concrete.
But for real, like if they seized every kid that they got a call about,
Right.
Yeah.
they
Yeah.
would need warehouses.
Yeah,
Oh my gosh.
exactly.
Yeah.
I mean, for
Exactly.
real, they
Yeah.
would
Yeah.
they would need like
Yeah.
hundreds of thousands
And
of square
more
feet of
often-
warehouses in every city.
Yeah.
And social workers, I think, often get a bad rap for this because they think,
Yeah.
oh, the social worker can kick in the door and take the kid.
Yeah.
If we have colleagues that do this job, and a lot of times they show up and go, hey, do you want to talk? Like, do you need some coaching? I brought pamphlets for you on
Yeah.
like things that you might, be on the
all the
lookout
resources
for.
you were talking
We're just here to
about.
help you. And like,
Yeah.
here's my number. By the way, I'm going to check again next week. And like, it's just something, you
Yeah.
know. And so and again, that's only if we're in danger, kind of stuff.
Yes.
But I like your advice, Nick, about finding that common point. Make the conversation start from there.
Ask them what they are willing to do. That's kind of what you said already.
Yeah.
But, just be curious. I tell people that a lot. Like, being curious about what's going on with them can maybe help them feel
It
comfortable.
goes a
opening up
long
too.
way. And as a friend, just not being judgmental and letting them vent. And like
Yeah.
you said, Nick, not necessarily having to challenge that. Like, even if they're just spitting their venom at you and be like, oh, I hate this. And I don't know if I want to be a mom. And I hate my relationship. And everything's a lie. And like, this guy at the grocery store is really nice to me. And maybe he'd be better. And it's like,
Yeah.
okay, good. Just get it out. Like,
Yeah.
just keep telling me
There
all
are
this.
a lot of techniques that I've used over the years working and treating addictions where clients will come in and they will complain and they're
Right.
just pissed off
Yep.
at all of these people
Everything sucks.
and they just want to vent to me about it.
Yep.
And I've kind of developed this technique of agreeing but not agreeing.
Sure. Yeah.
So like I'm agreeing with the frustration.
yeah. Yeah.
I'm not agreeing that your PO is out to get you.
Right.
I'm not agreeing
Yeah.
that the judge is
Yeah.
an asshole. I'm agreeing that must be frustrating.
That must be frustrating.
know?
But how often as therapists have
I
we had...
was just,
You're about to
I
say
was
it. Go
thinking
ahead.
of
Say
a
it.
story with teens.
Uh-huh.
Oh my gosh, I had a mom call me like, oh yeah, my daughter said that,
Yeah,
you know.
you said I'm a bitch.
Yeah.
Like, no, she said you're a
she
bitch.
said even you thought I overreacted. I was like, well, wait a second. She said you were overreacting. I said, it sounds like that was the strong
all
reaction,
the time.
right? And you're like just reiterating what they said.
Yeah.
I heard you, and they're like, see, she agrees.
All the
That's like-
time. The patient's like, that my mom's such a bitch. We're like, that must be really hard for you. And they're
Yeah.
like, it is.
Yeah.
And then they go home. They're like, even Whitney thinks
Yes,
you're a
yes.
bitch.
I'm like, I swear you're not paying me to.
No, I'm not.
Like-
I didn't say that. I swear to God. I just didn't disagree.
I just remind them, I'm like, we're building rapport.
Oh my
Sorry.
God. Anonymous, this is a great question. I'm so glad you asked it because so many people deal with this and it's not talked enough because it's a secret. It's this thing. It's like, I feel ashamed. I'm a bad person. If you know anybody out there who's a new mom, a new parent, check in on them, and new dads too, because this can be a form of depression that sinks in on everybody. It is such a big life disruption. Everybody's going through so much. Get those resources, support each other. We definitely don't want to keep it a secret. Great question. We're going to take a quick break, and when we come back, we're going to talk about a dose of reality. You're listening to Pod Therapy.
Today's episode is brought to you by Smitty Scoop, Nathan's Hot Dog Scoop, Mason Miller, Tess Miller, Dirty B, Byler T, Harris, Team Monaco, and Oscar Swanros.
Yeah.
And if you would like to sponsor the show, become a Theraproducer at patreon.com/therapy. We have had a lot of trivia questions come in through our email.
Ooh.
All right.
I think we're like 5 deep now.
Yeah.
So,
Those last
Are they all
ones
about
were
reviews?
amazing. Yeah, those review ones were really good.
we did get Myra did send in some more about movie reviews.
Oh,
Great.
nice.
So we've got that one coming up in the future.
Oh, good.
All right, hello guys, and Whitney McWaffle here.
Oh, McWaffle.
Yeah. I have a few trivia questions for you. Since I used to be a pastry chef, I decided to make them all pastry themed.
Hell
Oh my
yes.
gosh.
Hope you're not too hungry when you read them.
Oh, yeah. I got
All
it.
right, so she's highlighted them.
Eclair.
Oh, and we've
Ah.
got fun facts afterwards. So there's 4 regular questions and 2 tiebreakers.
All right. Do 2 and
Let's
2.
just 2 and 2.
Yep.
2, 2, and 2. All right, question number 1. Bertha Palmer, a socialite.
Socialite.
Socialite. I was going to say, that
You're
doesn't
doing
sound
great.
right.
Sociopath.
A sociopath.
Yeah.
They're all the same
We are
thing.
therapists, so that's where our mind goes.
From Louisville, Kentucky, is
Louisville.
credited with creating the chocolate brownie.
Huh.
Which event was the dessert? God damn.
You're doing great.
Which event was the dessert made for? Was it made for A, the 100th anniversary of Kentucky's statehood in 1892, the signing of the World War I armistice in 1918,
A good reason to celebrate.
Okay.
Theodore Roosevelt's 1905 inauguration,
Ooh.
or the 1893 Chicago World's Fair?
Oh, shit. Okay, first off, brownies weren't always chocolate?
Well, no, I mean,
they
it could have just been
exist?
the chocolate brownie as in like...
This is the first brownie ever
Yeah.
invented.
brownie.
Yeah.
All right, let's
So
choose to
maybe-
believe that because
Yeah.
I can't handle there not being a chocolate.
No, chocolate
That's
did not
how I
exist
heard it.
before
Right.
1800s.
All right, I think it's the
my
World's
instant
Fair.
thought went to World Fair
Yep,
before the
because I
choices
feel like
happened.
chocolate showing up is kind of important around the World's Fair time. All right, I'll let you take World's Fair
I'm taking World's Fair.
because I
I
kind
mean,
of want.
you could be on World's Fair with
I kind of
me.
want Theodore Roosevelt to be honest.
All right.
I feel like that's worth celebrating.
Okay.
Dude, Teddy is a beast. Anyway,
He's
don't
got a
get
whole
me
bear
started.
named after him.
The man is awesome. He got shot in the chest. Do you guys know about this?
No.
Yes.
Teddy Roosevelt got shot in the fucking chest during a campaign speech.
Jeez.
And then he finished the speech.
Oh my god. What?
He's actually had to speak, and he said, "Ladies and gentlemen, I don't know if you realize I've just been shot in the chest, but it takes more than that to kill a bull moose." And
Oh
then
my
he just
God.
finished the speech.
I'd be so scared after
Dude,
that.
he's
Yes.
such a badass.
Whatever you say, sir.
Oh, I hope it's Teddy. All right, what are
Okay.
you going with, Whitney?
I was gonna go with Teddy too.
Teddy's taking
Before the bullet in the chest story.
All right, but that sealed it for you,
That
right?
that was like
pretty
definitely
big
brownie.
selling point.
Yeah.
Give that man a brownie.
Totally.
All right, so you're with me on Teddy?
Yeah.
Nick, do you have the answer, or are you going to guess?
I'm gonna go I don't know, World War I armistice sounds good. I'm gonna
Yeah.
go with that one.
I like
show
that one too
respect
because
for the
I believe the enlisted men in World War I wore brown uniforms in World War I.
Ooh, so maybe that's the bit.
Yeah.
Nickname.
All right.
So I did think about that one for the naming of it.
Okay.
Well, turns out I am a genius,
Oh.
but I did get this one wrong.
Oh.
Unrelated.
Unrelated.
It was the 1893 Chicago World's Fair.
World's Fair.
point goes to Jacob.
Take that double.
Jakob.
That's a good point.
Nice.
Bertha was selected to be the president of the board of lady managers
I'd pick her
for the
too.
World's Fair. Yes, that was a real title. She wanted something like cake, but smaller, that could be eaten by hand and put in a bagged lunch. Thus, the brownie was born.
Do you guys
Thank
do
you.
brownie with ice cream on it? Like hot brownie?
Sure.
Scoop of vanilla
I'm not
on
mad
there?
at it.
I won't,
If it shows up, I'm not furious.
I won't say no.
I won't eat it all.
good brownie.
What is,
I've met people that have never done that. I'm like,
Do you know
"What?"
there's like people will make like the brownie, but it's almost like a chocolate cake with
like-
like frosting on top.
Yeah.
fluffy.
I don't like those.
Yeah.
I
No,
mean,
full
again,
I
bed
like
brownie.
the
like the a la
flaky-
mode, I'm happy to eat it.
Sure.
Yeah.
If it
I'll
shows
eat
up.
Yeah,
Yeah.
I mean,
I throw it on the ground.
It's not my preference.
Man.
No, not having it. My dad's not a cell phone.
Dutch immigrants bought the Oliekoek.
Mm-hmm.
Dutch immigrants brought the Oliekoek
It's
to
pronounced
America
cake.
in 1700s. It's considered to be the grandfather of what modern day pastry?
Huh.
All right.
It's from
A.
Dutch?
Yeah, the Boston cream pie.
Ooh.
B.
Oh, wait. I kind of tuned out because I thought you were still talking
The
about the brownie.
Netherlands
No.
brought a dessert.
This is another question.
And
Okay.
evolved into this dessert.
The Dutch brought the Olie cake.
Okay.
Oliekoek.
Man,
Oliekoek's
Oliekoek's great.
Bum, bum, ba-da-bum.
Okay.
Oliekoek.
Oliekoek.
Boston cream pie, donuts, cheesecake, or funnel cake.
Oh.
I want to go funnel cake, but
Yeah.
1700 sounds way early.
Give
for
me
that.
the options again.
Boston cream pie,
Uh-huh.
donuts, cheesecake, funnel cake.
Remember that time that I thought donuts were actually nuts?
I
And then somebody wrote in a whole essay explaining to me where donuts come from?
I believe I know the answer to this question.
All right.
Oh, you
So
go
I will go
last.
last.
Oh.
I kind of want to go donuts just because Olie cake. Donuts are.
I feel like it is donuts
Oh.
because I thought we got an essay on this. But honestly, I really want to go with the Boston cream thing.
Okay.
I mean, Boston cream pies are delicious.
I feel like it, I don't know what it is about that, but it feels Dutch to me.
If you're going to get a cream pie, get a Boston cream pie. Cream pies.
Cream pie.
Today's
Pod Therapy's brought
sponsor.
to you by Cream Pie.
All right. Nope.
From
nope.
Boston.
cream pies.
Nope. We're not doing
Best
that.
ones you can
We're
get
not doing that.
are in Boston.
I've already done it. It's done.
Whitney,
How do
what
you
do you
like
want?
them apples?
I'm going with funnel cake.
That's what you get for introducing me on an episode.
Oh yeah,
I've been
Jacob's
perfectly
here.
content to sit there silently.
I've been introduced. I'm doing Boston cream pie jokes.
All right, so I'm Boston cream pie.
Yeah, you are.
Whitney, what'd you take?
Funnel cake.
All right, you're taking
You're already on donuts, right?
Yeah,
I
you took
said
donuts,
donuts.
and then
Yeah.
Jacob, what's the real answer?
I believe it's donuts.
You think it is
Mm.
donuts? And the answer
It is donuts.
Yeah.
donuts for the win.
Donuts got their name because they are shaped like the nuts that accompany bolts for construction.
I said that. I said that a long time ago.
No, I'm not joking. No
yes.
one could possibly believe that.
Yes, I said that. I remember.
Sure you did.
Everybody made fun of me, and I told you that's why they were called donuts. And then somebody wrote, "It's like that's not what it was." But this person, thank you, McWaffle. You validated my entire existence. Oh my god, I'm so happy.
Lifetime.
You
made.
gave Jim an injection of knowledge like a
Here
mental
it is.
Boston cream pie.
There it is. It was a Vegas cream pie. That is a mental health cream pie. A dose of reality. God. And we'll just cut this whole episode. It's fine. A dose of reality from Miss Meds. Hey, folks, for some background, as I grew up, I faced homelessness, abuse, neglect, poverty, and I'm sure some other things I don't care to remember. I've never really dealt with these issues, and I think this has given me at least some PTSD, if not CPTSD. Now that I'm an adult, things have changed. I have a stable job, family, and hobbies. By every conceivable metric from an outside observer, I'm doing well. I'm also seeing a really great therapist who's doing a great job, and I plan to continue seeing them for the foreseeable future. Here's my problem. I need help broaching the subject of medication with my therapist. Mentally staying afloat is exhausting, and I want to at least have a conversation about getting some extra help. However, I'm afraid of rejection. I'm worried that because I'm so high-functioning and not visibly having any issues, that once I bring up the subject, my therapist will just say no. I recognize that this is a problem only in my head. I'm sure that if I do have this conversation, my therapist will be supportive, that they'll take me seriously and make me feel heard. But I'm just flat out afraid and I don't know how to talk about this. Any advice or encouragement you can give me would be awesome. Many thanks, Miss Meds.
Okay.
Common thing to bring up in therapy.
I don't have a good short-term answer to this.
Okay.
I've got kind of a long-term answer.
Playing the
So
long
I'm going to
game.
defer.
All right, you punt?
I'm going to punt for right
All right.
now.
I'll volley. I'll grab it out of the air real quick. This is a good question because I think it's something that a lot of people don't know that we want to talk about. Because they think, okay, like a lot of times people get us confused with psychiatrists and they say, oh, I'm here for meds. And we have to be like, wrong door. Like we can't do that,
I've
right?
definitely gotten that, yeah.
All the time.
Yeah.
But then people think, oh, okay, if you're not the doctor who's going to give me the pills, then you must not care at all. And like, oh no, we are very interested in what you're taking. And we're not shy about advising and offering insight. Mostly we educate about meds.
Yes.
Yeah, we don't tell you, you should take X. Because that, even if we're not prescribing it, is consulting on, well, not consulting on medication, but
It's like out of your scope.
it's out of scope. Yeah, it's a direct. So
Life coaches will do it.
now Jacob, on the other hand,
They don't give a
not
fuck.
We'll do it
only-
all
yeah.
day long.
Not only will Jacob tell you what you should
He'll
take,
just say,
he
"It's
brought
fine."
some.
Yeah.
It's
Jacob brought enough
fine.
for everybody, and he charges better prices
First
than the guy
taste
under the
is free.
bridge. First taste is free.
And no refund.
You been a little under lately? Let me tell you about a little friend called Coke.
Yep.
You've just been life coach.
He'll cheer you up quick.
So, Whitney, whenever people want to ask you about meds, I mean, what's the right way to approach you? If patients are saying, oh, do we talk about this? Can we talk about this? Are you allowed to tell me about this? How do you want them to come to you with this?
Yeah. Man, how do I want them to?
Versus how do they do it in real life?
I guess for me, in my assessment with them, I'll bring up meds, asking them if they're taking any medication.
Right.
And what I've started doing over time is, depending on what they tell me in that first session. So like if this were a client I was seeing and it sounds like you have a great rapport with your therapist.
Which is huge.
They probably, I'm assuming they already know a lot about your history that caused some of these like PTSD or CPTSD issues. So I would say you worrying about bringing it up is very normal because when we present well, when we're dealing with mental health issues, it feels like almost like you're disappointing someone or like they don't know that I'm really going through these issues. But your therapist is going to like feed off what you give them. So if you're giving them, hey, I'm doing great vibes, then they're probably not going to ask about meds or things like that.
Right.
So they only know what you tell them. They're only as good a therapist as you let them in to be. So by you bringing up medications or saying, hey, I'm really struggling with X symptom, like, man, I'm feeling really down lately and, I'm going to the gym, I'm eating well, I'm doing all the things.
Mm-hmm.
But it's still not working. I'm still sleeping a really long time or, some of these other symptoms. Then your therapist, if you are feeling those things and say, hey, I'm thinking about taking a medication, your therapist will 1000% be like your support system there and want to meet you where you're at.
Yeah.
Probably with curiosity at first.
Yes.
But if you have good rapport with your therapist and they know your history, that's not going to be a shocker or a surprise or a disappointment or whatever you're thinking you're afraid of.
Right.
There.
Yeah. So 2 pieces of information for the general audience. One, as we've already talked about, your psychotherapist does not prescribe medicines. Sometimes your therapist is part of a group and you also have psychiatrists or doctors as part of that group.
Yep.
And they are interested in talking to each other. And so if you're also seeing a psychiatrist, that psychiatrist may come over to your therapist and say, hey, Whitney, you see this person way more than I do.
Yes.
They've requested this. I think that sounds good. Do you see any reason why that's a bad idea? And so if it's a good practice, and that's rare, by the way, I don't think that that's super common.
No, it's not.
That you're going to have all those levels of care.
I mean, and I can think of a couple psychiatrists that I know that actually do talk therapy.
That actually know enough. Yeah.
Very, very,
it's so rare.
Very
because
so rare.
because they would be doing it, they would be losing money to do it.
Yeah. Oh,
Yeah.
it's a
because
waste of their time.
they make way more money
They're
doing
not
the
going to spend
medication.
an hour. They can
Yeah.
treat 4 patients in that hour.
Yep.
So the majority of the time, at best your therapist will be loosely connected to somebody who can make
Yes. Yeah. So public
prescribe.
education, if you're thinking, oh, when I go talk to Jim, my therapist, if Jim doesn't agree with me, he's going to blow the whistle and then my psychiatrist won't prescribe or my personal doctor won't prescribe. Oh, no. No, Miss Meds. They don't give a damn what I
No.
think.
No.
And that has happened lots of times. I've had people legit, I'm treating for addiction, who are like, oh, yeah, my doctor just gave me these amphetamines.
Yeah.
That's great. This is a great time in my life to treat my ADHD, when I'm trying to quit meth. It's like,
Yeah.
what the shit is going on?
Yeah.
And I've literally called psychiatrists and been like, what are you doing? And they're like, nah, he seems like an honest chap. Sure, it's fine. Like,
Yeah.
this guy deals. And so, trust me, writer, they don't care at all what we think. So at least you don't have to be afraid that but that actually, I think, improves your relationship with your therapist because that
Yeah.
means you can really talk to us
Yeah.
and there's no bad things. Now, having said that, I can see a situation where your therapist says, why do you want to take these meds? You're high functioning. We're making great progress. The test of every medicine for me, and I'd be interested in what your philosophical opinions on this are, but for me, the test of a medicine is always function. Is it increasing function? And if the patient's already functioning, to just add a med on top of that, a lot of times might tip the ship in a direction that I don't know we want to go in. And a lot of people are medicine curious right now because of TikTok, because of social media, because there's a lot of promises about pharmaceuticals. And they're like, oh, if I'm doing great now, medicine will make it even better. And they forget that all medicines have harms. And the only reason that we want to give them to you is because the problem is so much bigger than the potential harms that it's worth the risk. So again, I wouldn't be able to say no to you. Your therapist wouldn't be able to say no to you. I wouldn't be surprised if your therapist wanted to talk more and ask why you're interested in this and talk a little bit more about that. My last tip for you, don't walk in and say, I want to take this medicine. That annoys me. I don't love it when that happens. I like when you come in and go, I'm still noticing this symptom, and I was wondering about medicine options. Could you teach me about that? Start with an open mind, because if you come in and read me the serial number of the pill you want, I'm a little suspicious, yo. I'm like, wait a minute, how much recon have you already done on this? Which I'm fine with you self-educating, but nah, it seems a little enthusiastic.
That is something that I do something very parallel to.
Do you do that?
In my line of work. So
Okay.
for people who are new to the show, I run shows in Las Vegas. I run sound for shows in Las Vegas and build sound systems and all this kind of thing. I have the conversation all the time with singers, stage managers, anyone. It is, don't bring me the solution to the problem. Tell me what the problem is.
My job to tell you.
I'll fix it.
Yeah, that's right.
Because however you're telling me to fix it, probably
Right.
isn't how I'm going to fix it.
Right.
Yeah.
Yeah.
But the same thing. Don't go to any doctor.
Yeah.
A mental health doctor, or general practitioner, or anything. You probably don't want to go to the doc and be like, here's the meds I want.
Right. And
Let
I
the doc
get it.
do their job.
If you have ADHD or something like that, you're going to have a suggestion of I guess I'm looking for stimulants. It's really funny because this also shows you the difference between Europeans and Americans, because in Europe, they're not allowed to directly advertise pharmaceuticals.
Oh, yeah.
So the civilian population doesn't really know the names of stuff. And in America, people walk in, they're like, I want clonazepam extra term release.
Yeah.
60 milligrams. Where'd you get that from? Commercials during Seinfeld.
Yeah.
Okay. So people ask for it by name, but that would be my last point, is just don't be too specific. Come in curious, make it a dialogue about the problem, suggest medicines to see how you feel about it.
Well, so a couple things that I was thinking that are kind of a couple layers below this.
Deep. We're getting Inception on this thing?
Yeah, we're gonna
Therapy within therapy within therapy.
within therapy.
Love it.
So the first thing that kind of catches my attention is you describe yourself as very high functioning, and you're struggling, but you're concerned that your therapist isn't going to see it.
Okay.
So that tells me something right there. So maybe there's something more that we need to get into our talk therapy.
Yeah.
That maybe there's some stuff that's kind of hidden from what the therapist sees. So that's number one. So maybe that would be, and I'm not saying that I'm not steering you one way or the other with the medication.
Right.
I'm saying go for it. I agree with
But
Jim and
some
Whitney
things
if
are
that's
left
something that you need
unsaid.
to, yeah. But there's something there that's
Yeah.
still in this hidden area that we haven't tapped into yet. So that's the first thing. The second thing, which is kind of, again, my long-term approach, what if I was your therapist, I would say, all right, cool, let's have that conversation about medication, and I'm going to go ahead and I'm going to make a referral over to psychiatrist. So here's that. Go ahead, follow through with that appointment. Now let's go back to my fear of rejection.
Right.
Yeah.
What does it mean if I were to say no?
Right.
I was wondering that too.
Yeah, what does that
Yeah.
mean to you?
Yes.
Yeah.
Right? Because if, again, I know some listeners get tired of us always talking about CBT, but this is kind of a CBT approach, which is like, it's not the event that causes an emotional reaction. It's the meaning that we give the event.
Right.
So it's not your therapist saying no to you that causes an emotional reaction. It's what your therapist saying no means to you
Right.
that causes that reaction. So that's what I would want to explore. What is that meaning that you give
Yep.
that the therapist has that kind of influence and that kind of power? And I think that's something that's going to be a long-term thing to sort out. But it is something that kind of caught my attention.
That was some Inception therapy, Tangeman. I like that.
Damn.
Nick doesn't want to
if-
tell you
if
your
I had-
answer.
if
He
I
wants
had
to
a
talk
jingle.
about why you're not asking the questions.
If I had a jingle,
That would have been it.
Yeah. We'd be playing it right now.
Yeah, I feel like there's a theme song from Inception. I'm sure we can infringe on that copyright.
Did you hear the South Park where they did the Inception?
Oh, yeah.
One guy was talking and the other guy was in the background doing and doing the sound effects.
Did you know that in the Japanese version of Inception, it actually has like a subtitle on the screen telling you which dream you're in?
Oh, really?
In every scene.
Oh, that's
How do you know that?
I don't know. I read it on Reddit.
Oh, I was like, how do you,
So
did
it's
you watch
true.
Inception in Japanese? Is what
Also,
was
I
hoping.
only watch Japanese.
Yeah.
Right.
When I watch Christopher Nolan films, they're not already obscure and hard to follow enough. I have to see them in another language.
So we got to send Jim to Japan, is what I'm hearing.
There
That's
we
going to
go.
be the trip, the
There we
blind
go.
spirit trip. Yeah, Japan. I'm sure I'll make it back.
That would be hilarious.
Oh God, don't send me to Japan.
I wanted to add something real quick because Jim mentioned, that your kind of test on the medications, whether you should be taking the medication or not, is if they make you function at a higher level. And the writer could be functioning at a high level and just not be happy about it.
Right,
That's-
right.
yeah.
That's true. And
So,
emotion
there
does
is-
matter.
There is
Yeah.
more to it than just functioning, writer. I
Right.
mean, you go out of your way to say in your note that you're very highly functioning,
functioning.
and that's cool. I mean, it's great that you are. There is more to it than that. There's more to
That's
life than just
Absolutely.
functioning.
That's-
So, like,
Absolutely.
if that's where you're at, power to you.
Yeah.
Yeah.
Have the conversation for sure.
Still have the conversation.
And the therapist isn't going to stand in the way. You know, they're only
No.
going
And
to get you talking to another.
I would
guy.
also mention to the therapist that you really considered not telling them about it.
Yes.
Yeah.
I just go into all of it. And the therapist is just going to take it all
I was
in.
scared to tell you this.
And yeah, that's
I
it.
was a
And
little
that's
bit
fine.
nervous.
That's a
Yeah.
fine conversation to have with your therapist.
Well, and as a therapist, my clients that either started medication while we were meeting together or soon, like right before we started meeting together, I like to kind of periodically check in and see like what are you having any side
Right.
effects and things
Yes.
like that.
We do
And-
most of the medication management, and that's what people don't often think of, because you go see your psychiatrist like, great, I'll see you in like 4 to 6 weeks.
Yeah.
I'm going to see you next week.
Yeah.
So I'm going to know what's going on. And a lot of times we do advise and say, hey, you should stop that right
That's
now.
the
or you should call-"
education
Yeah.
component, right?
Yeah, we know
Mhm.
about it. We're not going to direct care or prescribe or
Yeah.
discontinue, but we're going
Yeah.
to say, I know enough about that, and I'm part of the treatment team. Call them, tell them what you just told me.
Yep.
this
Or
and
this
that
is
thing.
a little bit normal while you're adjusting. Things
Right.
like that, where people are like,
Yes.
I don't know if I like the way this feels. And you're like,
Right.
give it like one more week. And then
Your
see.
therapist is absolutely part of the conversation.
Yeah.
So should be roped in.
Yeah.
Great question. This is a great one. A lot of people relate to this. I think the bottom line, folks, open up, tell the truth. And if you're struggling with telling your therapist about something, that's a good indicator that you should talk to your therapist more. Also a good indicator. We're going to take a quick break. And when we come back, we're going to talk about an attention-seeking friend. You're listening to Pod Therapy.
Today's episode is brought to you by Smitty Scoop, Nathan's Hot Dog Scoop, Mason Miller, Tess Miller, Dirty B, Byler T, Paris, Team Monaco, and Oscar Swanrose. Would you like to sponsor the show? Become a therapy producer at patreon.com/therapy. Continuing on with our McWaffle questions.
Love these.
All right. The average cacao.
Man,
Sorry.
so good at this.
How you like cacao?
How you like cacao?
The average cacao pod weighs around 2 ounces.
True. Final
But
answer.
but not all of the bean is used in the chocolate making process. How many cacao beans are needed to
damn
make
it.
1 pound of chocolate?
Dude, I watched a
Closest
documentary on
guess wins.
this. I watched How It's Made the other day, and they totally did this.
Which means nothing right now.
All right, 1 pound of chocolate.
Yes.
Closest without going over.
Yes. How many? Okay. How
many
many
beans?
cacao beans?
And each
are
one's
needed?
2 ounces.
Are we writing this down so we can't over or under the person next to us?
I think you just throw it out there.
Ooh,
All right, so each bean is 2 ounces. How many ounces are in a pound?
at least
16.
2.
I think he's right.
Well, I mean, I think we just need how many pounds of beans to make a pound of chocolate.
Yeah.
Or,
You can do like 1.1 pound of beans.
All right. Yeah,
to
yeah,
make
yeah.
a
or
pound
wait,
of
I thought
chocolate.
it was number. It's not number.
number of
It
beans?
says how many cacao beans.
All right, you
are
gotta
Yeah,
get down
so
to the
it's
bean.
like
Oh.
1,000
Yeah,
or
so
something.
you got to do some math.
What?
yo.
Yeah,
All right,
that's why
so
I was like, is
no,
it over under?
16
like,
ounces to get a pound.
I'm giving you pounds.
That's 8 beans.
We can do the math later.
We can do the math later. I'm going to go with it takes 2 pounds of beans to get me 1 pound of chocolate. So my guess is like 32 beans. I don't know. Let's do Jacob's way. I say 2
Okay.
pounds of beans.
No, you say 32 beans. You say,
How many pounds am I saying? Wait,
Yeah.
he said
what are you doing?
he said 2 pounds and
2
32
pounds
beans.
of beans,
Two.
which
Okay,
I think
I'm
is
gonna
32.
I'm gonna go by the bushel.
Americans, we can't
So
agree
we'll
on
all
a
do-
standard.
Anything to get around the metric system.
yes,
at
yes.
At least 5 bales of cacao beans.
Bales.
Yeah.
We'll translate
How
that
many
later.
chipmunk mouths of beans can I get
I believe
into this?
it's a furlong of beans. If you lay the beans out end to end, not side to side,
Not side to side.
it is a furlong.
Furlong. All right, I'm going 32 beans.
Are you 32 beans or 2
AKA
pounds?
Well, 2 pounds,
Okay.
which I believe is 32 beans, but I don't do math.
I'm gonna go 500.
I know. I
Pounds?
was gonna
No,
go 500
500
beans.
beans.
You're crazy.
No,
They're 2 ounces a piece. That's 1,000 ounces or a mile.
No,
I don't
the,
do metric. I don't fucking know what any of
The
this is.
bean is 2 ounces, but you only take a little bit.
I mean,
out
it's at
of
least
the
8
bean.
decibels.
I don't know decibels. 3 kilojoules. 32 kilowatts.
It's for 1 pound of chocolate.
Yeah,
And you said you're taking how many beans?
500.
500 beans.
You're
500 beans.
insane.
And is that Kelvin?
Yes. Okay.
Yeah.
So absolute zero.
Yeah,
500
absolute
beans,
zero
Kelvin.
Got it.
I'm gonna do 300.
You're both crazy.
I'm
That
gonna
is
do
so many beans.
5 pounds.
Okay.
You and I are measuring in pounds
Yeah.
mostly.
I'll do
Maybe like
5 pounds to make
1,000
1
or
pound of
something.
All
chocolate.
right, get out your calculators, guys. I feel like we're gonna need to do some math.
It is beans.
It's
It's
measured
in beans. Okay, so how much does 1 bean weigh?
2 ounces.
2 ounces.
Okay.
All right. So, but now I need to know.
And what was your guess, Whitney?
300.
300. And I
how
guessed
many
500.
ounces are in a pound?
16.
that part I do.
Thank you, Siri.
16 ounces.
Thank you. Thank you, the Googles.
16 ounces. I should have said it like that.
You should just be my Siri now. I'll just say things.
Siri, how many?
All right. So then, yeah, I'm sticking to 32 beans then. Okay, that's
Okay,
my
so-
answer.
So I need, what do I need to do? I need to do 5 times
32
16
Yeah.
is 80.
Damn,
Yeah.
you did that in your head? Oh, calculator.
I'm holding a calculator.
You didn't ask Whitney?
Okay.
I know.
That's how I
Siri.
get things done.
So 5 times 16 is 80. So that's 80 ounces. How many beans per ounce?
16. Or no.
Two
2 ounces.
So
bean is-
a bean is how much?
2
2
ounces.
Okay, so I'm saying 40.
All right, and
Okay.
I'm
Okay.
doing 32.
Yeah, so I'm saying 40 beans.
So you're saying 40, you're saying 32.
32, and then
300
300
and
and
500.
Yeah, the gap is pretty big.
It's 400.
Jesus.
So
Whitney!
Whitney and I split. No.
No,
Oh,
Whitney's
you went
closest without
over.
going over.
It didn't say closest without going over.
We
It said
agree
closest
closest without
going
going over.
Closest without going over.
I asked closest without going
I
over,
heard
and you
him say
said
that.
yes.
Oh,
yeah,
you know what?
Whitney gets the win.
Nope. Here, I'm changing the answer right
Point
now.
what
It's
a
500
dick.
now.
Wow, that's a shitload
Whitney
of beans.
points.
Wow.
I would have guessed 500.
Is the
if
rest
Nick wouldn't.
cocaine? Is that what that is?
It's a
'Cause I'm
shell
don't
or
recycle it,
something.
right? You get the cocaine
Oh.
out of it.
Yeah,
too.
because it's a.
The
All right,
leaves are
I'm going to
cocaine.
go ahead and say that cocaine is not easier to make than chocolate.
You know,
I don't know that for sure,
bet.
but I'm betting on that.
It's only one way to find out.
I mean, a lot of cocoa butter get the chocolate going.
All right.
Somebody get me a lab.
We need to investigate.
A
Yes.
baked Alaska consists of ice cream covered with, meringue,
Oh.
okay, which is then quickly heated.
Huh.
Its original French name translates to what?
Baked Alaska.
La
French?
baked Alaska.
Yes, baked Alaska
La.
French.
Croissant.
Oh.
Norwegian omelet. Bolivian Snowball.
Bavarian?
Fuck yeah.
Bavarian Snowball.
gotta get you some
Also,
glasses.
all
French
of these are
bomb.
sex acts, and I just want to make that really clear. This is clearly right out of the Kama Sutra.
French bomb.
Yep.
Siberian boathouse.
Oh, that's dirty.
That's
The
what they call a
Siberian
cream.
boathouse.
That's what they call a cream pie.
Norwegian omelet. Bavarian snowball.
It's the original
French
name
bomb,
of a Boston cream pie.
That's the Russian love shack.
Siberian boathouse.
Siberian boathouse.
I'm going Snowball.
Okay.
Give them to me again.
The B-52 sang that, didn't they?
Norwegian
Siberian
omelet.
boathouse?
Oh, God damn it.
Bavarian.
Bavarian. I can't say that. Bavarian snowball.
Also, so
French
kinky.
bomb. Siberian boathouse. I'm going to go Siberian boathouse.
I'll go
Hell
French
yeah.
bomb.
Siberian boathouse.
And Whitney's got the snowball.
I got Snowball.
Yeah.
I'll do the Bavarian pretzel one.
That's the
Bavarian
snowball.
snowball.
That's
Oh,
the
never
snowball. So
mind.
you're
All
with
right.
Whitney then.
I was like,
No, I want to pick a different one. All right, so who took the Siberian
omelet.
boathouse?
The omelet.
I did.
All right, I'll take Norwegian omelet. That sounds
There
good.
you go.
It is the Norwegian omelet.
Of course it is, you idiots.
Oh.
Oh my god, these are fantastic. I love this.
This
I've
is
never
fun.
had a
I
baked
think we're like
Alaska.
all got.
Yeah.
like, have all
I've
got
never had that. So
I
what's-
got two.
Cacao is the word for raw beans used to make chocolate. Oh, yeah, we already know that. Once the bean is roasted and the cocoa butter is extracted, the remaining powder is called cocoa.
or cocaine or cocaina, as it's pronounced in
I
the
thought
South.
that was from the leaves.
Oh, it's only technically called chocolate if
is.
the cocoa butter is not extracted.
Oh, interesting.
There you go.
Okay.
Have you guys all had baked Alaska?
Yeah.
No.
No.
What is meringue?
It's
Isn't
like,
it just egg whites?
like on a meringue pie. Yeah.
I think it's
You
egg
didn't
whites
help me.
whipped.
You just described
Yeah,
the
it's
thing
like-
again. You just set it
You
up.
just like-
egg whites and sugar.
You know.
Talk to your phone. Whitney.
Siri,
what
all
is-
right, ready?
Whitney.
Let's see if I'm right.
Yeah, it's like
Speaking
egg
computer
whites.
voice.
There's some sugar,
and you just whip
some
it.
vanilla.
till it
I think is in
fluffs
there.
up.
So it's like a custard.
No,
No,
it's
it's
much
fluffier and
fluffier. Yeah.
lighter.
Okay. Huh.
You've had a like a lemon meringue pie
I
or
don't
something
think
before,
I
right?
have. I
With a
really
nice
don't.
fluffy meringue on top.
No. Is it yellow?
It's
Well,
cream.
it cooks.
Yeah.
So
the
it's-
peaks are browned.
Yeah.
Okay.
Cooking.
All right. I feel like I have a mental image of it, but I don't think I've
It's
ever
like
had that.
closest to marshmallow fluff.
Oh.
Is
But it's
what I would
much lighter
describe
than
it.
that.
It's lighter,
Okay.
but that same kind of texture.
Weird. The inventor of the dessert wanted to honor the man who discovered the insulating quality of egg whites by including his nationality in the name.
Wow.
Unfortunately, he was mistaken, and the man was actually British, not Norwegian.
Idiot.
As far as the omelet part goes, French people are just weird.
Yes.
All right.
Also counts.
And
Good
we would like to
questions.
apologize to all of our French listeners.
Yes.
Thanks
yes.
for thanks for tuning in up to now.
Yeah,
The
Jacob's French
dessertness of
voice.
the show. Attention-seeking friend from Anonymous. Hi guys.
I will do the
wish
rest of the
to-
show like this now. In on air.
of the Norwegian omelet and the Siberian
I call it-
boathouse.
Le Baked Alaska.
Oh God, Siberian boathouse is just—I'm never gonna forget that. Hi guys, I wish to stay
a great
anonymous
band
for this
name.
question. Oh, this is a good
Oh,
one.
yeah.
Hi guys, I wish to stay anonymous for this question, so give me whatever name you'd like.
Siberian boathouse.
Yes.
SB.
SB.
All right, Siberian.
Well, listen here, boathouse.
Cyber.
Well, let's see if this backfires.
It almost certainly will.
I feel like this has happened to us before. We're like,
Yeah.
great, we can go with this silly name. And it's like, and sob story. Well, let's cross our fingers, guys.
This is how I ate all my relatives.
Oops. I have a friend.
Accidentally.
Accidentally, allegedly. I have a friend. Let's call my friend Q. And they have been showing some attention-seeking tendencies within the last couple of months. I'd like to note that this friend is dealing with a mystery chronic illness that they've been trying to find answers for the past couple of years, but have not been given a solid diagnosis. They also deal with some mental health-related issues, like extreme anxiety, depression, and other undiagnosed issues, and they are currently in therapy. Q makes it very known to their friends and the public via social media that they are sick, and they mention it quite often. Whether it be because they're feeling down that day, have to cancel plans, can't do something because they're feeling ill, etc., I've done my best to show empathy and compassion for their situation because I know it must be rather difficult to go through this, but at times it's hard to do because this is a daily thing. It's not the physical illness, it's the mental that holds them back. I try to encourage positivity, offer kind words, and be supportive where I can. but it's a never-ending cycle. When something's wrong and they're amongst friends, everyone is usually quick to help or cater to them, which is awesome that our friends are so willing to be there for them, but it seems as if this help is starting to be expected and abused. I care deeply about this person and want to be there for them, but I also don't want to baby them or participate in the constant pity party because they really are so much stronger than they make themselves out to be. The doctors think some of the illness is stress or anxiety induced. So, when they're feeling great and on their A game, they go out with friends, take road trips, see live music, and other activities. But when their mental health is bad, so is the mystery illness. I am by no means saying they're wrong for feeling this way about themselves, because their situation is making it difficult for them to live a normal, healthy life, and I know they grieve that daily. But I feel like their biggest enemy is themselves in the end. And I'm not able to express that with them because of my fear that they might get defensive or feel attacked, as they very much dislike confrontation and are typically sensitive about difficult topics. There are other details I won't get into, but they have been known to over-exaggerate situations they've been in and very easily are triggered by small things that make me question the severity of everything going on. As a friend, I'm expected to not be around certain people, not invite too many people to functions, and constantly check in with them because things are often too much for them to handle. Am I the asshole for being bothered by this? I ask myself quite often, what about it is so wrong that it irritates me? But I can't reach a solid answer, so I can only help but feel like I'm being a bitch sometimes. I know I can't expect this person to stop feeling sorry for themselves, but I do have to be constantly reminded and asked to look after them every step of the way. I have several other friends with chronic illnesses and mental health issues that manage it themselves, hate asking for help or sympathy from others, and don't make it their entire identity. I'm halfway between I'm the asshole and I just need to be a good friend and be there for them because they're going through a lot right now, and I'm beginning to feel burdened and the sympathy I offer feels fake. Is there something I'm missing or lacking that's making it hard for me to be a good friend? How do I offer support and encouragement for them at this time when my feelings I have about the situation are the way they are? And is there anything I might be able to say or do for them that would help pull themselves out of this woe is me victim mentality? Mad love for you guys, Anonymous.
Boathouse, I don't think this is why you're the asshole at all.
Oh, good. We still get to use the name.
Why would that go away? Why would that go away? I think what you need to do, here's the thing. You give them the old French bomb.
French bomb.
No, here's the thing.
Boathouse.
So we've talked on the show before. Jim and I used to work at a rehab that was built as kind of a luxury rehab.
Yep.
And so it was catering towards
the
people.
biggest babies on earth. They were rich.
It was catering and was catered.
Give me my drugs back.
And so we did come across a fair amount of people who legitimately had, some serious problems that they were going through, but also have never really been in a position where they had to take action to solve those problems. Right. And so it was very difficult to get them motivated to see themselves as part of the solution, as opposed to them seeing everybody else has to change.
Right.
That's what I need to turn my life around, is this person needs to do that, that person needs to do that. And if that all happened, then I'd be okay.
Right.
And so, as long as that list isn't fulfilled, now it's not your fault that it hadn't been fixed.
Exactly.
Yep.
So my strategy that I've always used when somebody would, in a situation like this where, they kind of explain this story, and whether or not it is exaggerated or if it's genuine, my response is, oh my God, what are you going to do?
Put it back on them.
Yeah. And so I would always, and I had 100 different ways of saying, what are you going to do?
Right.
Because then they'll say,
what are you going to do?
Yeah.
What are you going to do?
It was all just different emphasis. You're going to do.
¿Qué eres tú going to do? I don't speak a lot of Spanish.
Yeah, no shit.
¿Dónde está la biblioteca going to do?
No, but like, oh, I don't know what I'm going to do. I have no idea. Oh, well, what efforts are you going to take to try to discover that?
Right.
And so everything was directed back to you.
I can't go to group today. You know, I'm feeling really sick. Those meds aren't working. I've asked the nurse for the medicines I need, and the doctor will not give them to me. So I do not feel good enough to go to group.
Yeah. So what are you going to do instead?
I'd like to sleep. I'd like to stay on this couch and do nothing.
How are you going to complete the program doing that? Right. So it's everything like I can do this all day where you can just constantly redirect towards this is where you're at. This is what you want to accomplish. How are you going to get from point A to point B?
Here's reality.
Right.
Judge ain't letting you off this thing until I sign off on this thing.
Right. Still got to have a consequence.
Yeah.
So we've all seen people like this with that external locus of control.
Yeah.
They feel powerless. They feel like they're the victim. And it's tricky, though, because you are. You are a human who's suffering with a chronic illness. You're a human who's suffering with mental health. Whitney, have you ever had patients that have fibromyalgia?
Not patients, but friends or family. Yeah.
I have
Another
worked
one
with
that's a
people that have
mystery one.
fibromyalgia.
A very tricky one.
Yes.
So
very tricky. Because
tricky,
it's a
yes.
diagnosis from non-diagnoses.
It's
right?
a diagnosis of pain, basically.
Yeah.
Right. It's just misery. And it is very affected by your attitude, your emotions, the weather, how people are treating you, how stressed you are, your self-esteem.
Yeah.
And it's tricky because you start reporting that to everybody, but then you're also offloading all of the you stuff to everybody else. And if you're the friend like this writer is, that'd be an exact example of feeling exactly this way and just feeling powerless.
Yeah, as a friend to somebody who's going through those things, originally when you were reading through the question, I was thinking kind of similar to what Nick was saying, where you don't have to solve their problems, is what I was kind of thinking. So when you had mentioned that as a friend, I'm not expected to be around certain people or not invite too many people to functions.
Little controlling there.
Yeah, I'm imagining like you want to have a party at your house and you invite them and they're like, oh, that's too many people for me. That's not my problem. You have a choice to come or not come. If
you are invited.
If you can't make it, I'm so sorry. We'll catch up a different time when less people are around.
And that's tough because, this might be one of those friends who will go, oh, wow, Whitney, I thought I was your closest friend.
I thought I would be included.
Yeah, you more want
You
to
are
see these
included.
other people.
You got the invite.
I know.
I
They
can't
might
believe you
I would
betray
love for you
me
to be
like
included.
this.
betray, right?
Whitney, don't you think I want to be there? I can't be there. I told you why.
I know, and I'm really going to miss you at this party.
That's called boundaries.
Yeah,
girl.
I
Good
know. I was
job.
like, boundaries.
I like it.
I'm really going to miss
Way to
you.
role model those boundaries.
And we'll catch up next weekend whenever it can be just you and I or whatever the normal thing they're comfortable with.
Right,
is.
but
And I'll
kind
tell you
of
this
what
right
Nick's
now,
talking
Whitney will not miss you.
No.
Yeah.
But she'll tell you.
She don't miss
She
anybody.
misses you a
It's a
little.
lie.
Yeah. She is a liar.
But that's a great demonstration
She
of
has
boundary
no
setting.
feelings.
No. Yeah. Let's just be honest, okay? She what do we call it? She's a Siberian boathouse of a woman. Yeah. All right. Cold. Yeah. You gotta break through the ice if you want to sail these shores. All right. Cold, frigid.
Such good boundaries.
That works. But no, that's a great demonstration of a boundary. And you're right to bring up to the writer, like, hey, at least hear us say it, even if you didn't know this yourself.
Yeah.
You're not the asshole.
Yeah.
You're not the asshole. Like, you're trying your best. You're trying to be compassionate. It's a very tough situation. But this is something that all of us as therapists and life coaches have experienced compassion fatigue. You know, where we're like, boy, your pile of shit just keeps getting taller. And at some point, it's kind of like, it's daunting.
Yeah.
And just for clarity's sake, you're not the asshole because of this. You might still be the asshole.
Other reasons.
We've only heard this part of this interaction.
I've never seen you park.
Yeah.
Okay. Yeah. Maybe you're over
You
the
might
line.
not return shopping carts to the
I
little
don't
bin
know
in
what
the
you're
parking
doing.
lot.
Yeah. Lots of things.
You
could make
might
you.
be an asshole. It's just not for this reason.
What do we feel about the friend now broadcasting on a daily basis this like weather report of how they're feeling and what they're going through?
I 100% relate to this writer.
Yeah.
Jim and Nick know this about me, and Whitney has not been around long enough for us to have this conversation.
Maybe.
But I have real problems when I feel that people are, shall we say, milking an issue, either a physical or a mental issue, to get certain types of attention.
Pity, sympathy.
Yeah.
That kind of stuff.
It is something that bothers the hell out of me.
And what about raising
and
awareness? What if they're like, "Hey, I want to be a voice. I want to talk about this thing." That's a fine edge to
it
skate,
really
isn't
is.
It?
It really is. Like that might be great.
Yeah.
It's for me. It's a case by case basis.
Yeah.
You know, some people I'm bothered by it. Some people I'm not. Sorry to the people that I'm bothered by it by. But
Right.
like,
Yeah.
you drew the short straw for whatever reason. For whatever reason, you know, the people who bother me with it, they bother me.
Right.
And I can't always quantify why that is, but like I am with you in that, and it's not a matter of, oh, I think this person is faking.
Right.
Right.
It is. I believe they are milking it. I believe they are
Well,
not even exaggerating.
in
But
your
I believe
defense-
they're getting everything they can out of it.
Show me a social media profile where they're spamming the same content and message every day, and you'll see that I'm incredibly disinterested in this,
Right.
no matter what it was. Even
Right.
if they were like, "Hey, raising money for this charity," and on day one, I'm like, "Oh, that's really good." And they're like, day two, like, "This is really important, guys. I only
Yeah.
talk about this charity. Like, welcome to this channel. I only talk about this." Like, okay,
Yeah.
at some point,
We're still raising that breast cancer money.
right, and that's good, but like
Yeah,
at some
we need
point, I'm
it.
like, I'm losing interest in your account. I'm losing interest in what you have to say about the world. I can kind of predict what you're going to say, and
So
it
you
becomes a
could-
burden to even look at your account.
So you could recommend to your friend that they get a social media director as part of their
I
life.
think that's where we're going
yeah.
with this.
They need a social media person.
Yeah, you
In
need
regard to
commenter.
social media, because I get Jacob's frustration with that too. And that used to bother me a lot more than it does now. But
And
like,
by the way, I don't call people out for it.
No,
Right,
you just
right.
become disinterested in
That's
their
it.
content.
It's
That's
just your
Bored.
feelings.
Yes.
about
But I
it,
think-
yeah.
I stopped looking.
I mean,
Yeah.
as far as like the social media thing, the way that I always look at it is I just kind of imagine like it's a tennis match.
Mm-hmm.
And like if they hit something on my side and it's not something I want to hit back, then I just don't hit it back.
Right.
Oh,
And
we
then
gotta
I'm
play
just-
tennis.
I'm just
You're also really bad at tennis, though. We should probably
yeah,
tell the audience
yeah,
that. They don't
yeah.
know that about you.
yeah.
Yeah. Never
Um,
won a match.
So it's like, okay, you hit this over here. All right, well, I'm not playing. I don't want to play that. Like,
Right.
oh, you hit a tennis ball. Okay, I'll hit that back over. But you throw a football over, and it's like, well, that doesn't fit. So I'm just gonna ignore that. Let that go away.
Right.
Now there are situations in which like I can't ignore it. In some situations,
Right.
I'm this person's supervisor at work.
Right.
Okay, well now I have to be involved and I have to do something.
Now I'm dealing with it
And
whether
then-
I want to or not.
Exactly. And then that's also, I guess the other thing, I try to be as empathetic as I can and try to understand like, okay, well, this person is going through some stuff. This is their way of coping with it.
Right.
Whether I agree with it, I don't, whether it's helpful or it's maladaptive, it doesn't matter. It's kind of their way of doing it. I don't think it's probably the most effective way,
Sure.
and maybe I can help coach them into a more effective way of dealing with it. But this is their way of dealing with it. But then I again go back to my strategy of like, oh wow, that sucks. So what are you gonna do?
Right.
Oh, I'm having a really tough mental health day. I know I've got all these responsibilities. I need to get away. Oh wow, that's tough. What are you gonna
How
do?
are you going to solve that?
What are you
Yeah.
going to do?
Yeah.
What? And then if it's something like, okay, well, I can help. How do you want me to help?
How do you? Yes, I like that
So
too.
I'm not going to
Still
just
giving them.
Yeah,
control.
I'm not just going to volunteer and say, okay, let me pick this up for you. I'll carry this.
Yes.
I'll take the responsibility. No, I'll say, okay, well, what do you need me to do? Is there a
Right.
way that I can help? You know?
And what's really tough about this is that, on one hand, I want to be the person that the writer's friend is talking to. I do that for a living. Like, yes, come to me, come
Yeah.
to a therapist, tell me every week.
We will take the burden.
That's right. And I'm meant to carry that so you can have better friendships. So you can language your pain and you can emote and we can use the right vocabulary and we can measure it. And I am interested in scaling it. I want to know how many units of suffering happened on this issue. I want to know how this affected that. I want to know how your friend, that cold-hearted Siberian boathouse Whitney, when
Yeah.
she invited everybody to that party, but too many people for you to handle.
Yep.
I want you to come to
She
me.
did not miss you.
And I want you to tell me what a bitch she is. And I want to be like, yes, as your therapist, boy, do I think that's productive for us to grapple with. But you can quickly see why I, wearing my emotional hazmat suit with years of training, am qualified to deal with it and your friends are not.
Yeah.
The same stuff that's healthy for you and I to talk about is toxic
Yeah.
for your friendships. And it's tricky because that doesn't mean we can't open up to people. It doesn't mean we can't be vulnerable. But we do have to appreciate there's a dose.
Yeah.
There's only so much that your friends can offer you. And that's why, Ryder, I think all of us are looking at you and saying, look, you're not an asshole. You're probably experiencing compassion fatigue.
I was just going to talk on that about,
Yes.
yeah, just burnout.
Burnout.
You know, being a social worker and in that realm and having friends that are social workers that aren't all therapists, burnout is real. And when you can't set that boundary for when to start saying no, it's exhausting.
Yes.
And so when they ask at the end, you know, is there something I'm missing? You know, and why is it so hard to be a good friend to this person? It sounds cliche, but boundaries are real and important for that reason. If you still want to be a good friend to them, you have to start stepping back and not just giving into everything they're asking or being there for everything they need.
Also, it's good for the friend. It's
Yeah.
good for that
Yes.
person,
Overall.
too, to not always have somebody who will rescue them.
Yes.
That's true.
And
They
that goes
have to
back to
start
what Nick was
fixing it.
saying in the beginning. Like,
Yep.
how are you going to fix it? They have to. They're
Right.
forced. Like,
Yeah.
yeah.
But
They'll
this-
have to fix it.
To be clear, this kind of friend, though, very much resembles water in the sense that they will find the lowest point.
Yeah.
So if you pull back and there's a half dozen people in your friend group,
Yeah.
now they'll start over-relying on the rest of them. And
Yeah.
they might be like,
So
you,
true.
on the other hand, have been kind of a Siberian boathouse to me, but these guys have been
Yeah.
more like Norwegian omelets.
You're
And
kind of a
so
Whitney.
You're kind of being a Whitney.
Don't be a Whitney, all
Don't
right?
be a Whitney.
I don't know
Or
why they
do
call
be
Oh,
a-
that's a great T-shirt.
Oh, yeah. There it is. Somebody make that for us right now. I want Siberian boathouse Whitney.
Don't be a Whitney.
She doesn't miss you.
But yeah, this person is probably going to over rely on others, and then they might come to you and be like, you just haven't been very friendly to me lately. And look, Ryder, you clearly are a very sensitive, empathic, compassionate person, but that's also why we care enough to tell you about burnout and compassion fatigue and how boundaries help restore that. And also, look, at some point, these kinds of people can become a drain on you. And that's also why we go to school and train and get licensed and get paid to do this, because this can't hurt us. We're not their bestie.
Yeah.
We're their healthcare provider.
Yeah.
It's a very different feeling.
Just had a new client who coming in from the get-go was like, I'm having all these issues and my friends and family, they either said like don't want to help or can't.
Right.
And I was
Right.
like, but they're like, so I need someone to talk to. I
Cool.
mean, obviously it hurts, but it's like, I can
Right.
imagine this person, their friend in this story, getting to that point where,
Right.
wow, I've gone through all my friends and nobody
Right.
really wants to hear it anymore. Let me go find someone to talk
Yep.
to.
And it's not your job to retrain your friend. You don't have to come to them and say, look, you're
Yes.
being a little much on the internet.
Yes.
Nope. If this is working for them for right now, great. And also, life will teach them to stop.
Yes.
Don't worry. Natural consequences
Yes,
find a
natural
way.
Yeah.
Yeah,
consequences.
natural consequences always
Big
find
fan.
a way to
Big
teach
fan of
people.
those.
Yep. One by one, you and other members of their circle will just take a few steps away so that you can catch your breath and get away from the intensity of this. And then one by one, they'll notice, why are people not around? And then hopefully they're talking to a therapist, because if this gets brought up to us, we're going to say, let's talk about your friendships. How much are you giving to them lately?
Right.
Are you being a good friend?
It's a two-way street.
That's right. You have to be a good friend to get, well, I tend to over rely. I don't know. Well, let's talk about what you post online. Let's talk about your last 3 conversations with this person.
Yep.
Let's talk about how much we're showing other people your inner world, which is good. And we want that vulnerability.
Yeah.
And as your therapist, we're also going to try to teach you how to do that in a moderate way.
Yeah.
Also, that mute button on social medias, it's real nice. Because if
does.
you
It's very
block
healthy.
them, if you unfollow them, unfriend them, whatever it is, whatever the media
They'll
is,
never
they can see that. If you mute them, they don't see it.
That's right. That's the secret. No,
That's
I
it.
love it. Anonymous, this is a great question. A lot of people relate to this. And again, you're not a bad person. We're not teasing your friend. We know they're going through a lot.
Yeah.
But we relate to you because you're the one that wrote in, and we want to support you in this and just validate your position, help you understand you're doing the right things. But like Whitney said, it's okay to put those boundaries down. It's okay to take a couple steps away. Others may do the same. Your friend is not wrong for seeking compassion and pity.
Yeah.
And guess what? They're getting it. And as long as there's still cheese on the floor, the mice keep coming, and eventually people clean up. And then we see natural consequences take hold. But self-care is okay for you. You're not an asshole. Not for this reason, as Jacob said.
Yeah.
Again,
You might be.
I've never seen, what you watch or, whether you're one of those kids that yells at other people playing Call of Duty. I don't know, so could still be an asshole,
Yeah.
not for this reason. As we get to the end of the show, again, welcome to all the folks who joined us from Reddit. I hope you enjoyed your first dose of the show. We air this every Thursday in the main feed. Find Pod Therapy anywhere that you find podcasts. And if you'd like, you can go to patreon.com/therapy. You can get the same stuff into the same app that you're using right now, except on top of that, you'll get our extended show, which is sort of where we let loose before and just hang out. It's a lot more comedy focused. We're not answering questions. You get that on Wednesdays. You get that a day early, that extended show. It has no advertisements in it. And every Monday, we put out extra content, usually deep dives into hard psychology, therapy skills, research, reviews on books, rants, all sorts of great stuff every Monday that drops in the Patreon feed. You also get instant access to our live Discord chat community, which is thriving, over 200 members discussing every episode. Lots of fun, lots of joy in there, lots of good vibes and lots of support. All of this is available at patreon.com/therapy. And I believe we've got some new supporters this week. Who's joining the party?
We have 2 new theropods joining at the $5 level. I've been dreading this. I know I'm going to screw up this name. Andres Savadra Molina and Anthony Camarata.
Perfect.
I think I nailed those.
I feel like you did fine.
Yes, I think I did really good.
Yeah, I've got no problem
Cacao.
with this. Cacao, I believe it's from a region of Spain.
And we have a new pterodactyl, Richard Bruins.
Bruins.
That's it. Bruins. Richard Bruins. Hey,
Yes.
Richard.
Hi, Rich. I'll never forget Richard wearing that shirt at sushi at
Oh,
Scoopfest.
yes.
That was literally just a screen grab from the Discord when I legitimately asked people for help to create a Twitch banner, and they made that horrible stick figure boat of us, like with all this random graffiti on it.
Yeah.
And he turned it into a shirt.
Yes.
Still one of my favorite moves ever. So subtle. And hey, it's the first week of the month. And so in the first episode of the month, we take a beat to thank everybody that supports us at the Therapod level and up. So let's thank some Therapods. Thank you, Dan Martin, Robert Paulson, Colin, Scoopstronaut, Linda Brandmeier, Corey Owens, Joseph Pengrazio, Brad Kiefaver, Christine Phillips, Tracy Replogle, Gavin Bristow, Carrie Terhark, Stacy Westerland, Scoopy Jess, Ian Whitefall, Kiwi Scoop Fruit, I think I Kiwi Fruit Scoop nailed it. James K, Chelsea Saracen, Craig Little, Katie Chiwakowski, Don Dorr, Jim Hunter, Adam Rabiznik, Okie Scoop, Brooks Lyle, Matthew Nair, Take It Evie Podcast, Todd Canfield, Felicia Butler, David Sorensen, Shayla Bullock, Scoopatron, Lauren Izzo, Stacy Coleman, Adam Petanuzzo, Mats Lenegren, Heather, Scoopator Ascending, Ian Soto, Jessica Cyphers, That Josh Guy, Dr. Scoop Little, Mama Ninja Scoop, Lee Popsicle, James Dawson, Colson Morrow, Jacob Harrington, Sarah Olo, Grumpy Lake Mead Park Ranger, Kiana Killjoy, Sam Buck, Karen McCulloch, Megan Smith, What Weekend, Some Nobody, Lila, Be Gay, Do Crimes, Kelly Gagner, Tony Skiana, Nippy, Brian Emra, Drew Hellage, Alec Lancaster, Matthew Johnson, Keely Flowers, A Literal Pickle, Matthias Vambabrandt, Hannah Marie, James Hubble, Max the Ginger Scoop, Ken Tinsley, Chemist, Stacy, Protect and Scoop, Ulti Ingi, Anonymous, Jim Mills, Smells Funny, Andres Saavedra Molina, Cody Charrington, Brady Malachek, Matt Kubik, Chad the Safety Lad, Walker Fluke, Philip Guyton, Tim Mystery, Almost Doctor, Nurse Joey, nailed it, Ilya Gribkov, Duffy the Slowly Getting There Therapist Bear, Brogan Hastings, Kierkegaard, Irvin Santon, Samantha Santi, Trisha Ortiz, Julius Capel, Melissa L. Geisler, Al, Nico, Christopher DeGursey, Joel McMillan, Kirsten Johnson, DJ Seward, Jeanette Ward, Mississippi Hippie, Tiny Home Travelin', Chris and Alyssa, Scott A., Chris Conway, Fifi, Laura B., Heather W., Patty Glad, Todd Vrooman, Christopher Aguirre, Anthony Camarata, David Williams, and Kate Police.
And we want to thank our pterodactyls, those joining us at the $10 level. Thank you, Ice Blue Scoop, Brian Lehman, Scott Brady, Fred Bashara Jr., Andrea Anderson, Lindsay Bashara, Frozen Cusser, Lori Eltsroth, Ryan Stewart, Richard Bruins, Robert Ward, Chris Sy, Schnonigan, Sandra McWaffle, Dank Butta, Andrea Langmead, Lovely Spark, Celeste Quintero, Kristen Robbins, and Pickett.
And we want to thank our bosses, and especially our partner, Dirty B.
Thank you, Dirty.
Thank you, Dirty. And the mysterious and shrouded Illuminati members of the fan club, the Theraproducers. Thank you, Jake Schneider, Robert Brownie Jr. Mint, Smitty Scoop, Ben Don, Judy Schneider, Kayla Lansbury, Dr. and Mr. Hot Dog Scoop, Malia, Leon Kassab, Cindy Ash, Mason Miller, Richard Macy, Carolyn Albert, Kevin Chamberlain, Tess Miller, Newstick, Sammy Scoop, Ben Stanley, Slap in Your Face, Polygon, Sarah Smith, Adam Hathaway, Byler T, University Jeff, Mike Helm, Myra, Paris, Samantha Cohn, Darren Cunningham, Lib, Team Monaco, Thunder, Cougar, Falcon, Scoop, Matt and Lisa Tangeman, Heyo, Oscar Swanrose, A Sunny Boy, and Slurpikaye, motherfucker!
And if you'd like to hear this episode uncut and unedited,
And why wouldn't you?
and enjoy our spontaneous side projects, go to patreon.com/therapy. And thank you for supporting mental health.
That's all the time we got for this week's session. Want to thank our landlords, Matt Mattingly's Ice Cream Social Podcast, and welcome to all the Redditors who discovered our show today. We hope you'll join us in the future. Remember, pod therapy isn't something you should keep all to yourself. Share this episode with someone who needs it by opening the episode's description in your podcast app and hitting the share stuff. Tag us on the socials when you do. It's at PodTherapyGuys on Instagram and Twitter. It's /PodTherapy on Facebook. And don't forget about the extra goodies at patreon.com/therapy.
Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick Tangeman.
I'm Jim Jobin.
I'm Whitney.
Thanks, and we'll see you for your appointment next
You
week.
are Siberian Boathouse.
Oh yeah, Siberian Boathouse.
Also a good
hobo
hobo
name.
name.
Hobo
Yes.
name.
That's the hobo name.
Why does she get the two good ones?
I know, those are really good
They're great.
ones.
Somebody at episode 1000, Scoop episode 1000, pointed out a good one for Jim, though.
What?
Paulie Mustang.
Oh,
That's a
yes.
solid hobo
Paulie
name.
Mustang.
Oh.
Mustang.
Jim, tell Whitney who
What's the
Paulie Mustang
reference?
is.
Paulie Mustang is the guy who invented the Ford Mustang. He actually signed his name on the engine block. He was the engineer
Yep.
that founded Ford. Well, with Mr. Ford.
Oh,
A lot
At
of
least
people
that's
don't
what
know that.
Nick and I got Jim to believe one time.
I was like,
Yes.
I haven't heard this story
But he's like,
before.
but that's just not true, though.
I know. It's like, is it? I
Yeah,
like
but-
the
but
confidence.
Jim
I like
believed
the
it for a
confidence.
while.
A Mustang is a horse, Jim.
I was like,
Jim believed it for quite some time.
Long enough for them to make a T-shirt. So
Nice.
there's now merch in the store.
merch.